It's just gone 6 minutes past 8. My name is Mahlase. This is Inside Eyewitness News on 702 and Cape Talk. And of course, this is the second hour of the show. If you're just joining us, remember you can start the show with us at 7 o'clock. In the first hour, we take an in-depth look at the week's top stories, and we also throw forward and look at the news agenda for the new week. Remember, if there are any stories that you would like us to cover, you can email us at inside@ewn.co.za. In the second hour of Inside Eyewitness News, it's time for our roundtable, and we are also live on EWN's Facebook page. COVID-19 is no doubt the biggest story of our time. It is dominating the daily news agenda, and the stories have ranged from monitoring the numbers of infections, the science around the disease, and also some of the corruption that has come with it. In his weekly newsletter, President Cyril Ramaphosa praised the media, saying it has played a key role in combating COVID-19. He also says that we have played a role in being the watchdog that we are required to be by exposing the acts of corruption and maladministration, forcing a national debate and leading to a number of high-profile investigations. Tonight, we are asking, how has the media fared in its coverage of COVID-19? For this virtual roundtable discussion, I'm joined by Eyewitness News' Cape Town editor, Charlotte Kilbane, specialist health journalist, lecturer, and media trainer, Pontsho Pilane, and researcher at Media Monitoring Africa, Azola Dayile. If you want to participate in the conversation, you can SMS us on 31702 or 31567. You can also call us throughout the show. Our numbers in Gauteng are 011-883-0702. Or if you're in the Western Cape, that number is 021-446-0567. We're looking forward to hearing from you. We want to know from you, what are the stories that you think that the media has failed to cover? Which are the ones that the media has done really, really well on? Or what are the gaps? Where do you think that we should be focusing as the media because of this critical role that we play in informing you, members of the public? I'm going to start this conversation with Eyewitness News's Cape Town news editor, Charlotte Kilbane. And I can tell of our own dramas as COVID hit our shores in March. And the first thing was making sure that we close the offices and our reporters start working from home, because while everybody else, some people couldn't go to work, our reporters were frontline workers.
Absolutely, Mahlatse. And boy, I never thought I would have to deal with anything like this in my career. And you and me both, we've been doing this for quite a while, and this was just something else. It was trying to get an entire staff of reporters off the premises, which is not the way that newsrooms work. You know, newsrooms are inherently social places, and journalists are social people, and we need that kind of collaborative creativity that drives ideas and that necessitates face time, actually, to be in a group, to yell at each other, to contest ideas, to be in physical proximity, which of course this pandemic just made impossible. We weren't allowed to be anywhere near each other, to have those arguments, to yell at each other, to share those ideas. It all had to happen on Zoom calls and WhatsApps.
And I mean, the one thing was always that we needed to still tell the story. And we are people that usually go to newsmakers, whether it's ordinary people, it's those in authority. We go and find the stories, but now we had to worry about the protection of our reporters. Are they safe? Will they be safe?
Absolutely. And that obviously raised a lot of moral questions as well for us as newsroom leaders about how far do we push it, and this constant reinforcement to reporters. If you are going out, you have to be socially distanced. Never go out without your mask. Making sure that people had liters and liters and liters of hand sanitizer in every news car. Every time you saw a reporter, every time you spoke to a reporter, do you still have sanitizer? Do you have your mask? Are you keeping your distance? And of course, tragically in the Western Cape, when Lungile Tom from ENCA passed, that was just the most incredible blow, I think, for so many reporters in the Western Cape, because we all knew him. And it happened so suddenly. And, he was this gentle, wonderful giant of a man who was so kind and would always protect the kind of, in our world, radio reporters work alone. So you've got, more often than not, women, young women going into dangerous areas all by themselves to report the news. And Lungile was somebody who would put them behind him, and so I think that really, really brought it home for us that, frontline workers, as we like to think of ourselves, we're not immune. And it was dangerous work, that field work.
That is true. It really brought it home. I'm going to bring you in here, Pontsho, on this conversation. I mean, this is things that you would usually do. You are a specialist health reporter. You've always focused on health, something I will admit many newsrooms have largely ignored as newsrooms become smaller and smaller. Very few of them have specialist health reporters. But now all of a sudden you saw your beat being covered by everybody.
Exactly, Mahlase. Thank you so much for having me. I think, what happened with COVID is that, yes, we've been covering health, but covering a pandemic is completely different. It's a public health emergency. There are certain priorities that as a reporter, you should have more than you would usually have. For instance, thinking about really that you're not just reporting on or holding the government accountable, but you are people's first contact when it comes to information about what is happening with the pandemic. Research shows us that, particularly when we look at health literacy, a lot of people, a lot of citizens in South Africa and across the world, health journalism or health news is often their number one source of health information. So now it's a pandemic. It's not just about informing people, but it's about giving people information
educating them.
Yes, educating them. And so it becomes a bit difficult, and there's a little bit of a higher burden or something bigger at cost here. And so it was kind of a shift in mentality and ensuring that things like repeating the symptoms, ensuring that we're very clear about what kind of information we put out there that does not cause panic in the public sphere, and all of that is also taken into consideration as we report on it.
That's actually quite a powerful thing that you're telling us there, Pontsho, that, people are not necessarily going out there to go and research what is this disease, how do I protect myself from this disease, but they're actually relying on news media to save their lives. Essentially, that's what they're relying and depending on the news media to make sure, to help them save themselves.
Definitely, Mahlatse, the HSRC, South Africa's HSRC, also just released a study a couple of weeks ago that showed that even health workers say that their number one source of information about the coronavirus is the media. So if health workers, if people are depending on us as journalists to disseminate the correct information, that is a big responsibility. And therefore, how we convey, whether it's the numbers, whether it's around what should we look for in like the projections of numbers and whatnot, we determined essentially the public atmosphere around, or the public attitudes around COVID-19. That's not something you should take lightly, particularly if you think that we were also influential in terms of health workers relied on us. So they were relying on us to also convey certain messages from the president, from the Department of Health, and from the World Health Organization. That's an incredibly big responsibility.
No, definitely it is. And I will bring you in later, Azola. But I mean, Charlotte, the one thing, as Pontsho was telling us there about how heavy the responsibility is on us, this one was quite difficult because for me, the one challenge was the science that was shifting, and we were supposed to be telling the story of the science.
Absolutely. And I think it was a great example of where two disciplines and two professions didn't match each other in cadence, because journalism moves fast. It needs definitive answers. It needs an answer for a user, for a listener, for somebody who phones the news desk and says, I don't know what to do. We're supposed to have the answers and we're supposed to have them quickly. And science doesn't work like that. Science starts with a hypothesis that gets tested, that gets debated, that a couple of studies get done, and then it kind of rolls along and it's iterative. And yes, journalism can be iterative, but that's not the way journalism is tooled. So the mask issue was probably the biggest issue. We definitively said, going on what the health minister had said, what the World Health Organization at the time had said, do not go and buy masks. You don't need a mask. Don't go and buy a mask. Don't buy too much sanitizer. Leave what is necessary for the frontline health workers.
Yes.
And literally 3 weeks later, we were having to say, sure, sorry guys, actually the science has moved on. You're going to need a mask. You're going to need as many masks as you can possibly get, because you're going to have to wash it every day and you're going to have to wear it all the time. And we have been wearing masks ever since. So those kinds of things that are really quite tricky to deal with.
Yeah, and that's one conversation I want us to go deeper into later on. And I'm sure Pontsho, I see her nodding. She's got a lot to say, because in her field, you just don't go with what is the latest. You wait for peer-reviewed information. And with this disease, it just wasn't easy. But I want to bring you in, Azola, because you actually have the advantage of just looking over what the media, what stories the media were telling, but most importantly, who also they were quoting. Perhaps before you go into details of the study, just tell us what you were looking out for.
All right. Thanks, Mahlatse. So what we were looking out for was after the first case of COVID was positive COVID case in South Africa was reported, we saw a jump in South African publications in terms of what they were reporting, because what we saw last year, towards the end, when the pandemic was, COVID-19 rather, was reported in Wuhan, there were very few local publications that looked at it. But then when it came here in South Africa, we saw a huge jump. So we decided, okay, look, let's test it out. So we used what we call Dexter, which is an in-house sort of scraping tool that looks at online publications. So that's another important aspect. It didn't look at perhaps broadcast media or print media, but online publications. But we do understand that both broadcast channels and print media do have sister publications that are at least digital. So we looked over about 40 publications looking at trends according to racial and gender demographics in terms of who gets to speak, whether they're male or female, men or women, according to also gender, yes, race, as well as affiliations. So where do these people come from? Is it a particular political party that gets to speak the most? Is it scientists? Is it school teachers? So those are the particular trends and undercurrents we were looking at. And we've published over 5 reports so far, but covering different brief periods. So, yeah.
The one thing that really surprised me about your research was that the most quoted person was President Cyril Ramaphosa. I mean,
Yes.
Was it because of the family meetings? I mean, I was just saying earlier that, we were having the family meetings, but they were not as regular.
Yeah.
But he is the most quoted person even before Health Minister Zweli Mkhize.
Yes, that is what we also found and found very much surprising. But what we thought was also an influence of that was the fact of his weekly columns, where most publications then would reprint some of the speeches or quote from his weekly column. But outside of that, he's a general newsmaker himself, whether it's related to COVID or whether it's a by-mention in COVID corruption that does not necessarily to do with regulations or with policy, but maybe with corruption around COVID. He also gets a mention there, even in bypassing stories, for instance, with his spokesperson around the corruption around there. He also gets mentioned in passing. So, his name is really out there, and yeah, generally that's, yeah.
And where were the experts? I mean, how much were we talking to experts in this coverage?
Not much, Mahlatse, not much. So for experts and, general citizens on the ground, perhaps people who are unemployed, who are hit hard the most by COVID, were not necessarily accessed much. We saw that communication was centralized in what I would call, elite voices. So people who are in government. We heard a lot from Dr. Nkosazana Dlamini-Zuma. We heard a lot from Minister Tito Mboweni at some point. Sibonga Konke Nxumalo, around correctional services at some point. So it generally changes, but it's still government voices. It's still centralized around government. So we hardly get to hear, experts. The experts that we did hear from was when there was a controversy around, I think was it Dr. Gray. That's when we started, picking up around
Linda
experts.
Gray.
But that was around controversy and not necessarily experts being accessed to break down what, this pandemic means, what people should do or whatnot. That's what we found.
Pontsho, you've also been just monitoring the coverage of COVID-19. Are you surprised by the findings of Media Monitoring Africa's COVID-19 coverage analysis?
Not at all. Some of the reasons that Azola has mentioned around the president is a big newsmaker, and so what we're seeing is that as Media Monitoring Africa has rightly pointed out, that we find that his speech or his letters, his Monday letters, get quoted more than ever and whatnot. But also, what we saw is the politicization of the pandemic, right? Where we were not accessing, and I say we because I don't, I am part of the media fraternity. I'm not trying to turn against my colleagues who are not necessarily health reporters, right? So what we were seeing, or what I was observing as well, is with the politicization is that we veered off and we're not necessarily covering the public health aspects of it. Remember, Mahlatse, as we began, I said that, covering a global pandemic, there's a responsibility, or covering health or public health issues, there's a responsibility that we have as journalists that is not necessarily the usual kind of responsibilities where, so if I'm writing a story, like one thing I observed is the earlier stories did not necessarily repeat what was COVID-19? How do you contract it? How do you prevent it? This is what you need to do. They didn't quell a lot of the initial panic, right? And actually, I think to some extent, what we did as journalists is that we almost we caused a little bit of panic by not necessarily focusing on the public health information, by not necessarily focusing on explaining what the president's address meant from a public health perspective, looking at studies and what was happening in other parts of the world and saying, and I think, one of the biggest thieves or one of the biggest disadvantages that we had is that it is a global pandemic of a disease that has never existed before. So there's not a lot of information that was available, but I think a lot of our colleagues were not necessarily understanding or understood how to operate in that system. And by that, I particularly mean that it's okay not to know and to say that there is no conclusive
I was going to say, because the scientific world itself did not have conclusive information on this pandemic. And maybe that's why a lot of people decided to just rather stay away from this very difficult, controversial world where scientists themselves were at each other's throats around the science.
No, definitely, it was that. And I think perhaps we could have been more transparent about the fact that we didn't know enough and the experts that didn't know enough. And I think, again, it's not just about looking at the journalists and what we did as a media industry, but also looking at, I think South Africa is in a different position than other parts of the world, that we, because of our HIV and TB pandemic, that we've been through other big public health issues. Our own scientists and health experts are more media friendly than others. However, what I saw is that we didn't have enough expert voices saying and reiterating that perhaps we don't know enough, but what we know is social distancing, is a
Wear a
preventive
mask.
measure and whatnot, and wearing a mask and whatnot. And I think we saw some of those elements, but I think we also did a very good job as trying to tell the stories that were happening on the ground. One of the biggest kind of things that popped up for me is not just the politicization, but wanting to catch government out, right? Some of the reporting was very leaned into almost blaming the pandemic on the government, and understanding what the role of the government is in ensuring that there are protocols and systems in place to prevent a lot of damage caused by the pandemic, but understanding that the pandemic itself is not a government manufactured problem.
Yeah.
But however, because of the politicization and perhaps even the kind of unhappiness and dissatisfaction that South Africa finds itself in, I think we leaned into blaming the government more than we should have, especially in the beginning, particularly with the regulations. We were not very rigorous in interrogating them from a very objective place.
That's an interesting one, and I will ask my two panelists if they actually share that agreement, that were we trying to blame the government somewhat for this pandemic, or maybe was it because they seem to have so much control that we never imagined a government to actually have. If you're just joining us, this is Inside Eyewitness News. My name is Mahlase. I'm the editor-in-chief of EWN, and we're having a conversation and basically asking if what has been the media's coverage of the pandemic COVID-19. What are the stories that you think we have missed? Do you also think that we have politicized this pandemic and tried to catch out the government, or do you think that there are stories that we have done really, really well? Did we empower you, as we were hearing there from Pontsho Pilane, saying that, you know, a lot of people actually depend on the news media for their public health knowledge and actually the information that they would need to essentially save their lives. My panel this evening is Charlotte Kilbane, who is the Cape Town Eyewitness News editor. And I've also got Azola Dayile, who is with Media Monitoring Africa. And he was just telling us that President Cyril Ramaphosa was in fact the most quoted person as we covered this pandemic. And then, of course, we've got Pontsho Pilane, who is a specialist health reporter, who also is a lecturer and a media trainer and has been focusing on covering this pandemic. Charlotte, to bring you in there, do you also agree? Do you think that we were trying at points to politicize the pandemic? Or was it because, you know, all of a sudden the government could tell you where to go, where not to go, what to wear, what you couldn't wear? Could you go to work?
What you could buy, what you could display in your shop windows, etc., etc. I don't think as a media we tried to politicize it, but I think the nature of South Africa is that everything is politicized. And I mean, if you think back to the beginning of hard lockdown, there was actually a concerted effort by political parties to say, we're all in this together, let's pull together and do this together. I don't, to be honest, think government did itself any favors by being really opaque about some things. And I have to be clear that when I say this, I'm not talking about the health minister and the health team, because I think more than any other part of government, Zweli Mkhize and all of the technocrats and the scientists who were working with him in this effort to kind of stop the spread and to, what was the big thing? Save lives, stay home, save lives. That they were amazing. I mean, I remember sitting in my lounge one evening, having been up since 4 a.m, 11 o'clock at night, and they were still doing a briefing. They were doing 3-hour briefings, and we know that they would have been up since 2 a.m, kind of thing. And yet they were willing to do that, to give that kind of time, to explain very technical aspects of the modeling, of the way they were making their decisions. So that was the health part of the government, but then there were other parts of the government that really just couldn't answer. And that you would ask a question, why are we doing this? We don't understand how this feeds into, to Pontsho's point, how this feeds into the public health problem. and we would
Like you can't buy cooked chicken. Remember that?
yeah, I mean the cooked chicken thing, even down to the cigarettes. Like really, when people's all really, that's your best answer. Come on, and I think in that regard, government did itself no favors. Those parts of government did themselves no favors. But you know, when I think of the way the health department and all of the people working under the health department, especially in hard lockdown, the way they showed up, I mean, I found that quite inspiring as a South African.
I mean, I'm going to ask Azola the same question around whether we've tried to politicize this, because in their study, actually, in terms of affiliations, the most quoted party was the African National Congress. This came way ahead of the presidency, and also even academics, experts, and researchers. I think you've got here the African National Congress at 35%, and then academics, experts, and researchers at about 7%.
Yes, that is indeed the case, Mahlatse. But I'm not quite sure for which particular sort of report you're talking about. But that has generally been the trend throughout our research, that we find a lot of ANC leaders speaking on matters of national importance, particularly COVID-19 analysis. So you'd find that, the COVID-19 pandemic. So you'd find the Deputy Secretary General, for instance, Jesse Duarte, also makes it to the list in one of our reports as one of the most, quoted ANC leaders, at least. Then there's also the SG himself, Ace Magashule, who's also, quite quoted a lot as the Secretary General of the ANC, and the ANC being, of course, the governing party itself.
Was a lot of that coverage around the corruption around the tenders?
Yes. That is definitely around that. But also around other sort of like policy-related issues. They also commented a lot when there was lobby around cigarettes and alcohol to reopen. The ANC also came out to to defend its deployees in government. But as to go back to your question, Mahlatse, of whether there was a level of politicization, even though this did not form part of our study. Myself as an analyst or a researcher do in fact believe that there was a level of politicization of the matter, perhaps not from the media as as a broad entity, but from particular publications generally. And if you have just a browse through headlines, just headlines, without even going deep into the text itself, you'd find that there is a level of politicization. There was a time where also particular decisions were said to be taken by, or at least the framing was as if it was Dr. Nkosazana Dlamini Zuma, the COGTA minister, who took the decisions, and the entire sort of government had to come out, and quell this misinformation, to say that actually these are the decisions of the committee, the entire committee, which Ramaphosa, I think, chairs. So it's not a decision, a individual decision that she took. There was also at some point where Dr. Zweli Mkhize's own qualifications came into question. There was a time where people were not necessarily believing that he's actually a qualified doctor. And for me, I believe that there is a level of politicization where, particularly because, as Pontsho said, this was the first time that this government had to deal with a pandemic of this nature at this scale, so there was a lot generally that they had to deal with. But I think we didn't cut them enough slack. Perhaps that is warranted, perhaps really, because people's lives are at stake here. But in the greater scheme of things, generally there was politicization, I believe. As Charlotte also pointed out, that in South Africa, in any case, what is not political in the first instance?
That is very true. That is very true. And I mean, Pontsho, I'm just thinking back also from the beginning of this pandemic, just in terms of there seemed to be some centralization of communication, where there was a belief that health experts were being gagged and we shouldn't be speaking to them. And there was that war that literally went on between who the media could actually speak to. And I guess also because this pandemic required certain experts, not just any health experts in the media, we took our time to find our feet in terms of who to talk to for the right information.
Exactly, Mahlatse. So I remember when the public discourse was around gagging of certain people are the ones who are supposed to speak and who can't speak. And for me, looking at it from a public health perspective, I did not necessarily find it wrong that there are certain people who have to speak, because we are trying to disseminate a public health awareness message, right? Like beyond just any kind of comment, we need comment that is clear, that will not cause panic, that will help us in fighting the pandemic. And it's not necessarily that we're saying that there can't be dissent or there can't be dissenting voices when this happens. However, how do we, as the conduit, I'm saying journalists and media organizations, as the conduits to public health PSAs all of the sudden, how do we manage that relationship and frame it in a way that does not create a situation where it feels like there is a gag, as you're saying, right? And so for me, it would be, yes, I would always I'd speak to a lot of sources, some of my sources off the record, to be like, I really need you to contextualize this for me. And it's like, I think public health experts were quite frank in saying sometimes they didn't know. However, how do we balance between wanting certain information? For me, it's sometimes when we were asking as the media for certain information, my question was, to what end? It wasn't clear. Like, it's like, okay, so you want this information to do what with it, right? And I felt like we sometimes struggle to articulate the reason we believe that this information is going to help us cover the pandemic in a certain way. So, okay, if this was a political scandal, I would understand why you want this information. But for instance, if we go back to kind of like the arguments or the dissent or the conflict around modeling, right? Yes. So we don't have enough, like, this is from a scientific point of view and a public health point of view. We do not have enough numbers to be able to do modeling that is accurate. And like, for me, it was like, do we as journalists actually understand what that means? That yes, we might want numbers and to see what we could be coming into or what we could be going into, but scientifically and epidemiologically, we can't necessarily do that. And I just found that we failed, particularly to convey that message to our readers, our viewers, and the public in general, because perhaps it was chasing deadlines, wanting to be the first to break a story, wanting to find a different angle into covering it, that sometimes we didn't ask the basics questions. Like, I remember speaking to a journalist who's not necessarily a health reporter, and they called me and they were asking, they wanted to know about the vaccine, right? When are we going to get the vaccine? So they're like, hey, can you give me a contact of somebody who'll tell us when we're going to get the vaccine? And I'm like, let me tell you, it takes about the shortest vaccine we've gotten is in 4 years. We're 2 months into the pandemic. We're nowhere close to a vaccine. And this does not mean that scientists are not working or that like people are just sitting around not caring. But this is the procedure of what a vaccine trial has to go through before human trials begin. And this small information like that is unless you are embedded within health or science reporting, it's not necessarily information that a journalist will have available to them or know a second.
I've got an SMS here that says, I was relieved when the media, under difficult circumstances of COVID lockdown, managed to discover the corruption of money meant for protective gear. This made frontline workers be aware that there was no need for them to repeat or run short of protective clothing. Of course, that has been the sad part of covering this pandemic, just knowing that there are people who literally save money that was meant to save lives, and even save the lives of the frontline workers who were working extraordinary long hours to protect people in our hospitals. I'm going to come back to my panel now, who, of course, I'm joined by Eyewitness News' Cape Town editor, Charlotte Kilbane, also specialist health journalist and lecturer, Pontsho Pilane, and also Azola Dayile, who is a researcher with Africa Monitoring, who have actually been looking at, who's with Media Monitoring Africa, who have been looking at South Africa's coverage of this pandemic. And I'm going to bring in quite a controversial topic, conversation that is going on our Facebook page. And Pontsho, I think you started hinting at it with, were we supposed to cover the denialists? Because that is actually the conversation here, where I'm going to just read what Marty van der Riet is saying this whole thing is a means of controlling people. It has nothing to do with COVID. H1N1 was worse than COVID, yet we were not locked up. Of course, with any public health pandemic, there's always a denialist. And the question becomes, as the media, do we cover that and expose it? Or in the interest of public health and ensuring that, we are able to save lives, go with known scientists who believe in this pandemic. Charlotte, do you want to start us off there?
Yeah, well, I mean, we had a denialist very high up in our government in the AIDS pandemic, didn't we? And that didn't really get us very far, did it? So hundreds and thousands of people died who shouldn't have died, because somebody wanted to have a debate about whether HIV caused AIDS or not, instead of just rolling out the ARVs and saving people's lives. So, I think my personal view is that when the body of science is overwhelmingly leaning to something and there is clear evidence that something is a clear and present danger, when we have numerous examples from around the world that frankly you can't cook up in some conspiracy theorist's garage to say, well, Italy is collapsing, it's a conspiracy theory. No, Italy's health system was collapsing. New York was collapsing under the weight of this thing. So I don't see how anybody could believe that could be fabricated or cooked up. It's just plain to see that was the case.
I see Pontsho nodding there. I'm assuming you share the same view?
Definitely, Mahlatse. As health journalists, there's a term that we like using. It's a quote from scientists. It goes, what do we want? We want evidence. And when do we want it? We want it after peer review. So for me, that's always the answer, right? What does rigorous science say about what the situation, particularly if it has to do with health? And so what scientists say, what scientists are explaining, what the research and the numbers are saying, that is what I will go and believe. And this is not that I believe science because it's in a peer review. You look at methodology, you question, you probe. And if those things align and show that this is scientifically sound, then that is what you report. However, it's not saying, like, for instance, we have Africa Check, which is one of the biggest, if not the biggest, fact-checking organization in Africa, right? So there is a way that we can report on denialist information in a way that empowers citizens. So reporting on it in a sensational way does more harm than good, right? But if we report on it in the way, for example, as Africa Check does it, which is usually to say, okay, people believe that drinking hot water with lemon cures COVID-19. However, research says that this is what's in lemon, and then you take all the scientific and the lived reality that is there and put it together, and then you're empowering citizens and the public with all the information that's required. You've covered the misinformation, you've covered the claims, but you've covered them in a way that does not do harm. And you, as we all know as journalists, one of our number one rules is do no harm. And so we need to think about it in a different lens, particularly during a public health crisis like this. What does it mean to do no harm? Am I giving my readers, am I telling my listeners information that empowers them to make a decision that protects them from this this global pandemic that we're going through? Or is the way in which I present my information going to cause them to not take it as seriously as they should, or to panic about it? And you want to be in the middle instead of on either sides.
And I mean, Azola, I'm just wondering if you think the media has been responsible in terms of how they cover it. And I'm asking here because Portia Malindi on Facebook says, What about the million graves in Gauteng? Because that's one of the headlines that did dominate when people were really afraid of this disease. Azola?
Yes, Mahlase, I didn't get that. Sorry.
No, I was just saying, if you think the media has been largely responsible in covering this pandemic, because Pontsho was saying that, first thing has to be do no harm.
Do no harm,
And
yeah.
I'm just saying here that, I've got Portia Malindi on Facebook who's saying, what about the million graves in Gauteng? I guess trying to remind us that there were some headlines that were perhaps misleading.
Yeah, no, definitely. In that instance, the media really dropped the ball, but generally, they were quite responsible. And I think one of the factors of them being responsible was, as we had said earlier, the centralization of COVID comms by the government. So particular scientists spoke rather than giving willy-nilly anybody who would then come. So if there was this level of centralization already, by the government, where not any doctor in the country already, outside of denialists themselves, can generally come and speak on the matter. So I think that really had a factor in how then the media were responsible, became responsible in terms of communicating COVID generally. But there was general misinformation, particularly on social media sort of applications. There was debate around 5G, having a cause on COVID. There was a lot of those going on. And in efforts to curb these sort of messages from spreading like wildfire, the government did in fact start a WhatsApp sort of misinformation group. But also generally, as Media Monitoring Africa, we do have a particular tool called the Real 411.
Yes.
Where there is an expert panel, a media specialist, a law specialist, who then look at suspected cases of disinformation or misinformation and give a verdict of whether it is misinformation, and then we put that out on social platforms to sort of like curb that particular narrative.
Yeah, and I mean, Charlotte, did we find that as newsrooms as well, that misinformation that was out there changed the news agenda, where we had to now respond to it so that we can give some correct information, but also just the habits of South Africans finding themselves and dominating the news agenda. And I'm thinking here about, things like drinking lingana, which became a thing outside of the media, but the public itself was having those conversations.
Absolutely. And a lot of our time, especially during that first part of hard lockdown, that level 5 lockdown, a lot of our time was spent chasing around after bits of fake news, which we kind of knew was fake, but you still have to check, you still have to make sure, and you still have to actively counter those things. I mean, there were things that were obviously fake. There was a WhatsApp voice note that was doing the rounds about how if you washed all your bedclothes and then hung them in the sun, sunlight kills COVID, and then you just have to gargle with apple cider vinegar. And I mean, my cynical side went, somebody with an apple cider vinegar manufacturing company has put this out to drive sales of apple cider vinegar, because there could be, if it was that simple, we wouldn't have a global pandemic, would we?
Yeah.
But people, when they're starved for information and understanding, and if something is forwarded to them by their best friend or by their mum or by their uncle, they might listen to those things. And that is, in a case like this, that can be very, very dangerous. If people think, well, yeah, okay, apple cider vinegar and I'll be fine.
Yeah, because I guess we're always looking for easy ways out. Pontsho, to what effect did, some of the controls that government put in make it difficult for us to cover this pandemic? I'm just thinking, every time I watched international news agencies, I would see them inside an ICU ward, and you are seeing a patient trying to survive COVID. And then in South Africa, on the other hand, we were not allowed to access the public hospitals, but we were told that they were actually being overrun, but we couldn't show the public these visuals.
No, I think that was, I think the last time I checked, we had one of the strictest lockdowns to happen in the world, which kind of tells us already where we were already kind of positioned in terms of, there was a little bit of resistance from government to open up particularly from a point of like the ICUs. I did see in a recent week that our colleagues were able to go to particularly the NASREC Center, where they were government allowed them in to take photos and to talk to nurses. So I think, Mahlatse, and it's not a COVID problem, right? I think it's a South Africa problem where we have a government that does not necessarily, our relationship between government and the media industry is a little bit strained. I would like to say that there is a lack of trust from both entities. And this has nothing necessarily to do with COVID, but as with everything that we saw during COVID-19, what it did, it was exacerbated by the urgency of COVID as a global pandemic. And so I think some of the things that we saw around even the gagging of certain people, or certain people need to speak to the media, there is generally a lack of trust between government and the media fraternity. I think sometimes government officials think we're out to get them, and I think sometimes we are, which is not necessarily a bad or a good thing. We can talk about that another day. However, I also think that we think that government is not completely honest with us. And I think it is, like, from just my own research, particularly as a media scholar, I've seen it, the bureaucratic nature in which the government communication system works is not necessarily very media friendly. An example I'll give you is that one of the biggest first kind of media government conflict was around, why are we not getting the statistics in terms of Excel sheets? Why are we getting them in PDF? Because data journalists and journalists wanted to churn the numbers and see their own trends. And like the not so forthcoming nature from government to give journalists and give us access to those numbers in their raw form so that we can work with them the only way we want, the way we want is also like a problem. So I think we have a problem that is outside of COVID, where government and the media don't necessarily trust each other. And it can be a good thing, but I think it can be hampering, particularly during a global pandemic when we need to actually work together.
And I mean, Charlotte, I'm just thinking here how frustrating it was also where, in the Western Cape, for example, you could zero in into Khayelitsha and know what are the numbers in Khayelitsha. But then you came to Gauteng and you couldn't do the same thing about what's happening in Soweto, for example. And they were telling us that, it's because of stigma, or, they were just finding all sorts of excuses. And that made telling the story a bit more difficult, because at the time, we know that there were people in townships who were saying this is a aeroplane disease. It came via the plane and it's not affecting us.
Yeah, and I mean, I gotta say, I do work in the Western Cape. This is kind of my beat, and this is where my newsroom, my part of the EWN newsroom is. And they were very, very efficient in this province about getting granular details out very quickly. And I know that Gauteng did eventually do the same thing, and there was a more sort of granular approach to it. But I think that really helped as well. Although there was a potential downside to that in reporting it, where it gives people in neighborhoods that aren't the big hotspots potentially a false sense of security, and potentially a sense that, well, you can just, it's fine, it's not here, don't worry, go out, do what you need to do. Where at the time, certainly when the numbers were just spiking in the Western Cape, we all needed to stay and we all needed to do, what was advised, because the numbers were out of control.
We have quickly ran out of time. I cannot believe it. It went by so quickly. It's 2 minutes to 9. So I'm going to give you each a chance to just say, what should we be improving on as we go into lockdown level 1? And of course, the risk of the numbers of infections increasing looms ever so large. And I'm going to give you, Azola, as somebody who's not necessarily in the newsroom, what should we be improving on? And then I'll give the other two ladies to have the last say. Azola, you've muted yourself there. Yeah.
Yes, the classic Zoom blooper. But in any case, yes, definitely. So what we could do better as the media would be to reiterate this message of people, keep on washing their hands, keep on social distancing and wearing the masks, because going down a level or two does not mean that, the pandemic itself or COVID, the disease itself, has dissipated or has moved. So if the media could, reiterate that and perhaps give a little voice to the people on the ground.
Okay, and I thought you'd also say maybe have more women as experts because I see that's one of the
That could
challenges
be a
we have.
general South African problem. I think that's a
Yes.
general South African problem.
Okay, and Pontsho?
I think facts. We should always contextualize the facts into what it means for public health. And we shouldn't forget the public health implications that this pandemic may have. And we should never forget that even when we're talking about the economy, even when we're talking about the corruption, we should always remember the public health implications.
And Charlotte, I'll give you the last word. What else should we be looking at as we go into lockdown level 1?
Yeah, for me, more human voices. But I think we've had a lot of human voices on Eyewitness News, but nowhere near enough. And I think with the levels coming down a bit, we have more access to those human voices, and access is a little bit easier. And I think the way we tell the story of how we rebuild has to be through human beings, because it's not about Tito's policy. It's not about the president's latest 19-point plan. It's about how people on the ground are experiencing that rebuilding, and that's really important.
Thank you very, very much. That was Eyewitness News' Cape Town editor, Charlotte Kilbane. She was, of course, part of the roundtable discussion tonight with specialist health journalist and lecturer media trainer, Pontsho Pilane, and researcher at Media Monitoring Africa, Azola Dayile. And that has been Inside Eyewitness News.
This is Eyewitness News.